So my name is Dr. Erin Zerbo. I'm an assistant professor in the Department of Psychiatry at Rutgers, New Jersey Medical School. I run a large buprenorphine clinic there, which is mostly serving underserved Newark residents. And I'm also part of the Center of Excellence of Northern New Jersey in medication-assisted treatment. That's a new statewide opioid initiative. We're working with Cooper University Healthcare in Camden, and we're rolling out the Matrix model, which is a new model in order to encourage community providers to start prescribing more medication-assisted treatment. Sure. So medication-assisted treatment is 3 different medications. We have methadone, buprenorphine, and naltrexone. Methadone and buprenorphine are both opioid agonists, which means that they activate the opioid receptor system, whereas naltrexone is commonly known as Vivitrol, that long-acting depot injection, and that's an opioid antagonist or an opioid blocker, so it's actually blocking that system. The whole idea is that through research studies, what we found is that if people are not on one of these 3 medications, they have a much higher chance of death. In one study that mostly involved methadone, it looked like their chance of death was 66% higher when they were out of treatment. And so we're really making a very strong push now to make sure that people are on at least one of these 3 medications. We have the most evidence for methadone because it's been around since the 1960s. Buprenorphine, commonly known as Suboxone, has been around since 2002. So we have strong data for that, but not as much with methadone. And then naltrexone, or Vivitrol, is very much a newcomer in just the past few years with a handful of studies, but it does also look like it reduces overdose death in that way. So methadone and buprenorphine are both very long-acting opioids, and they have a slow onset and a slow offset. So meaning that you don't get a big spike when you first take them. If people are opioid naive and they take it, they are going to feel like it's an opioid. But once you start taking it every day, you develop what's called a steady state level in your bloodstream. And so you take it kind of just like a vitamin in the morning and you won't really feel it. If you take something like Percocet, for example, it's a short-acting opioid, so you're getting a bigger spike of that opioid effect, and then it's falling off, and then you're kind of going into withdrawal or feeling the effects wear off of it. So the main difference is just that long-acting nature allows it to kind of stay on your receptor and stay in your bloodstream, whereas the medications we use for pain that are short-acting are much quicker on and off. There are longer-acting medications for pain, and something like MS-Contin, for example, is like a long-acting version. It's going to activate the receptor at 100%, whereas something like buprenorphine would only be at 40%. And so you're getting a little bit less of the opioid effect, but both of those are also long-acting medications. So family, I think, is a crucial component, and more so than family, it's really that supportive recovery network that can be incredibly crucial to people in their recovery. I think the point that we're trying to get across is that everybody should have access to medication-assisted treatment, whether or not they have a family, a support network, housing, whatnot. We want everyone to have access to it, but in order to have a full recovery, you have to develop meaning and purpose in your life, and humans are very much social animals, and so having those social interactions can really be crucial to giving you that meaning and purpose. So it's definitely a really important piece of treatment, but I would say in order to reduce the mortality, you have to have medication-assisted treatment offered to someone as a baseline and a starting point and really educate them on the importance of that, and then build in other factors after that. So if you or a loved one are looking for help or looking for more information on this topic, a great number to call is New Jersey Connect for Recovery, and that number is 855-652-3737. They're available to talk you through counseling options, treatment options, and also just to give you more information about medication-assisted treatment.